My name is Chris Whiteknight, medical esthetician here at Allure Medical Spa. Today I'm here to show you how we do Dermapen with Fraxel and PRP. The first thing that you want to do is make sure that your patients have all their forms filled out and signed, which are their consents, before you begin treatment. So for the first step, after you've done all your paperwork, you want to make sure that your patient has cleansed skin ready to apply their numbing cream. The numbing cream sits on anywhere from 20 to 50 minutes depending upon your patient's tolerance for pain. The numbing cream has benzocaine, lidocaine, and tetracaine in it, so do make sure that your patients do not have allergies to it. While you're applying your numbing cream, it's a great time to go over what to expect with treatment as well as their aftercare. Once you're done applying your numbing cream, you will then grab your medical assistant to draw her blood so that you can begin your PRP processing while the patient's numbing. Now that you've grabbed your medical assistant, she's going to start processing, getting the blood drawn completed so that you can make your PRP in the centrifuge. For the treatment, you typically only need one yellow tube drawn to do your treatment. So now that your blood's been drawn, you're just going to go ahead and put it in your centrifuge to start your PRP process. Set for 5 minutes. Now that your PRP is done processing, you want to get your laser loading and get ready to start treatment. Always have everything ready for when you go to start your treatment. That way you have everything at hand. Now that we've processed her PRP and her amount of time for numbing is complete, we're going to go ahead and remove the numbing cream on her face before we begin her Dermapen. Once you're done removing the thick layer of numbing cream, I always wipe the skin with alcohol before proceeding with treatment. The first step is going to be the Dermapen. Dermapen is microneedling, which will help cause pinpoint bleeding before you begin your laser treatment. It will act as a delivery system for your products as well as your PRP. So for Dermapen, you apply a gel on the skin, which helps give you glide for the microneedling. I generally like to just apply it overall in the beginning. That way you're not making pit stops in between. With Dermapen, I always have gauze at hand. I tell the patient to turn to the left, and I begin on the right cheek. Your depth you want to make sure is equivalent to how deep that you're wanting to get it. So generally on cheeks we start with at least a 2.5, which is the deepest that it will go. Then you click it on and you start with your procedure. If it's dragging a little bit, you can always apply more gel. Just means it doesn't have enough. You want to do nice, steady swirls going across the skin. This does vibrate, so it can tickle on the nose area of your patient. Some areas where they might have more wrinkles, or if they have scarring, you can focus a little bit more on them, kind of giving them a little bit more of an aggressive treatment. You can connect hose on to the Fraxel itself to blow the cold air onto the patient directly. And I always let patients know that if it's not cold enough to let me know, and if it's too cold to let me know as well. Go ahead and turn to your left side for me. If it is not cold enough, let me know and I will turn it up, okay? So then you load your laser and your air. And you begin on your left cheek, turning over. Here we go. When you're doing your passes, you're basically doing an upward motion, and then you're doing a cross to complete your 4 passes. You want to overlap at least about a 10% to give the patient a good treatment. Now that you've completed your Fraxel laser treatment, I always give the patient the air to keep on their face. That way they stay nice and cool while I mix their PRP up. So you can apply it onto your patient's skin. Just gently kind of rub it in. This will help take the sting out that they're feeling and that sunburn feeling that they have going on. As you're doing this, I turn the air down. That way it does not dry out the skin too much and stick on the skin a lot. Because otherwise it will get really tight on the skin. Now that you've completed all those steps, that completes your patient's treatment for the day. I usually let them lay down with the air for a little bit just to get nice and cool before you send them out the door. That way they're comfortable when they leave. Make sure they have a clear understanding of what to expect for their aftercare. That completes our Fraxel Dermapen PRP. Again, my name is Chris White Knight, medical esthetician here at Allure Medical Spa.